This is CBC Here and Now.
So over the last couple of days, we've seen a really serious incident where a couple of children were involved.
The views are spectacular, but those waves can be dangerous.
A warning to be careful at Middle Cove Beach after a close call this weekend.
We are beginning to see an encouraging trend with more recoveries and new cases, thereby reducing the number of active cases in the province.
It is a promising sign more people are recovering from COVID than are getting sick.
After some of the coldest air we've seen so far this season, this weekend, we're going to start to see a warm up, but that also means some messy weather is on the way.
Good evening and welcome to Here and Now. I'm Peter Cowan.
And I'm Carolyn Stokes. We begin tonight with the latest on the pandemic in this province.
Yes, there are 14 new cases of COVID-19 to tell you about. That's the smallest number of new cases in the last 6 days. 12 of those are in the eastern region. The other 2 are travel-related, one in Central and one in Labrador Grenfell Health. Health officials say the case in Labrador is someone in the military who had no contacts outside of work, so they say there's no risk to the community. Today is also significant because we saw more people recover from the disease than we saw new cases. There were 37 new recoveries, so that's leaving us with 407 active cases. Dr. Janice Fitzgerald says it's a good sign.
I am cautiously optimistic that we are making progress, but we are by no means out of the woods. We were fortunate to have detected this outbreak when we did, and we have to do everything we can to prevent another occurrence.
So it's now been 10 days since we entered the level 5 lockdown. We know the cases early on were high school students, but today I asked Dr. Fitzgerald to give us an idea what's changed and what type of people are now testing positive.
Our average age has gone up to 32 years, and I think earlier on it was down around 20. And the median age is about 25 years. So we are seeing a slight increase in the 40 to 59 year age group, as well as the 20 to 39 year age group. So we're, that's what we're seeing now. We've also seen a few people who were asymptomatic throughout their isolation who tested positive at the end of their of that isolation period in the last couple of days when we asked some of those students to get retested. So we did see some positives pop up there again.
Now there are a few other interesting new developments, including that they're going to start monitoring wastewater for COVID. Why are they doing that? Well, I'll answer that question and a few more of your COVID questions a little later on in the show.
Well, Health Minister John Haggie is fielding a lot of questions about vaccines. The province is working to inoculate high-risk groups, and many people in remote communities have already been vaccinated. But some groups, like nurses and firefighters, are still waiting for shots. Here Now's Mark Quinn reports.
The problem is we don't have the vaccine. So, I wait each week to see what the guaranteed tray number is for the next week.
As concerns about the more contagious variant of the virus continue to percolate, people are getting more anxious about immunity. Today, CBC News heard from a worker at the Health Sciences Centre who said people who should be vaccinated haven't been yet.
Quite frankly, not everybody stepped up first time round, and my understanding of the uptake was it did vary. It was pretty good amongst healthcare workers, but quite frankly, I've never yet seen a vaccine campaign that's got to 100% of eligible people. But a healthcare worker is not a healthcare worker in the sense of them all being a homogenous group. There are some that are at significantly elevated risk compared with others. And so we've tried to focus on that group first. And we have relied on the RHAs and directors and VPs to advise us of who those individuals would be.
Firefighters are another group with concerns. Dozens of them are now in isolation in the St. John's region because of possible contacts with positive cases. Haggie said he can't make promises about when they'll be vaccinated.
Unfortunately, because of the kind of rationing approach that we've had to adopt with vaccination, they kind of fit in the middle. Again, until we kind of see the whites of the eyes of these vaccine trays, it's really very difficult for me to give any kind of firm commitment, because if I did it today in the hopes of settling down and reassuring people, the only thing I could guarantee is the date I gave you would be wrong.
Shortage of supply means mass immunity will have to wait, And until that happens, public health officials say isolation and distancing are the best way to keep the virus from spreading. Last week, 8 healthcare workers tested positive for the virus, and more than 400 healthcare workers went into isolation. Eastern Health said it has created staffing challenges. Mark Quinn, CBC News, St. John's.
The United Way says it's getting a steady stream of calls to its helpline as the Alert Level 5 lockdown continues. The 211 telephone service launched in this province in October, and since then, there has been about 800 calls. When averaged out, that's 125 people looking for help per month.
Food security is our biggest call-in right now. We can refer to mental health supports. That can be anything from a warm line for seniors who just want to have someone to talk to a more regular counseling session with a certain other group. That could be peer counseling or someone that will help you find actual counseling support later on. We can refer to women's shelters. We can refer to LGBTQ resources. We can refer to senior supports in general.
The mild temperatures again today through portions of Labrador into the minus single digits. That's the story across the island as well. But it was quiet weather through the afternoon today. We do have our next weather maker moving in. That's going to bring in some mild air. We can already see that low pressure system just back to the west. That's going to move in as we head through tomorrow, already prompting some special weather statements for much of the island, as well as a wreck house wind warning with gusts upwards of about 100 kilometers per hour tomorrow afternoon. Just taking a quick look at the snowfall amounts for tomorrow. Most looks like it'll be for the southern portion of the island, and then a widespread 5 to 15 centimeters for the rest. I'll have all those details coming up.
Thanks, Ashley. Well, it was a harrowing ordeal at Middle Cove Beach on Friday. A wave struck 2 children and nearly swept them out to sea. As Here and Now's Heather Gillis reports, the town of Logie Bay, Middle Cove, Outer Cove is warning beachgoers to be careful.
Beatrice Clow often finds Middle Cove Beach a serene place to sit with her mother and have a coffee and conversation each day.
I love being by the ocean. Like, it's just calming. And
she was standing on this platform Friday afternoon, watching unusually high surf and a family who were nearby on the beach when everything changed in an instant.
And we noticed that the children and the parents were in the water, like it came right up to the shore.
Chloe snapped these pictures of the family as the children were nearly swept away by a large and unexpected wave. But she says the father quickly grabbed the kids.
Oh, my heart just sank. Like, I was so frightened for them and their parents.
Once the water receded, Chloe says the family of 4 who were shaken up managed to get out of the water and off the beach.
They went straight to the vehicle and started taking off their wet clothes.
Meanwhile, Logie Bay, Middle Cove, Outer Cove Mayor Bert Hickey has a warning for anyone who wants to enjoy the beach. Stay away from the water and the ice falls.
And that could have been fatal. So we will have some serious discussion on what we can do to certainly bring the attention to the general public of the dangers coming down here.
Hickey says it isn't uncommon for a rogue wave to hit this beach. He says it isn't the first incident, and he's worried because it's happening more and more. Though it seems today few people were heeding Hickey's warning.
Extremely dangerous because large chunks of ice fall off that cliff, especially when it starts to warm up. And we have had injuries here. We've had some serious injuries here.
He also wants people to stay away from the ice falls, another popular attraction for people on the beach. Police also issued a warning Friday urging people to use extreme caution in this area. Chloe has a warning too.
The waves can get really treacherous, and just be really mindful and keep a watch out, especially if you bring your children along, and like the force of nature can be devastating.
Well, one of 2 people responsible for killing Loretta Saunders has been denied day parole. The parole board decision against Victoria Henneberry comes almost exactly 7 years after she and her then boyfriend Blake Leggett killed Saunders in her Halifax apartment. Saunders is from Happy Valley Goose Bay but was studying in Halifax. The CBC's Blair Rhodes reports.
In the past, Victoria Henneberry has always tried to downplay her role in the murder of Loretta Saunders. But at a parole board hearing earlier this month, she finally admitted her actions played, quote, a significant role in the death of the young Inuk woman from Labrador. Henneberry also expressed remorse, although the board says she showed no emotion, causing the board to say it was difficult to determine whether the remorse was sincere or self-serving. Henneberry has claimed an Indigenous heritage and tried to avail herself of programs available to Indigenous inmates. But fierce opposition from the Saunders family caused one support program to bar Henneberry from attending for the length of her sentence. Henneberry pleaded guilty to second-degree murder and must serve a minimum of 10 years before she can begin applying for full parole. Meantime, her boyfriend, Blake Leggett, pleaded guilty to first-degree murder and faces a minimum of 25 years behind bars. Blair Rhodes, CBC News, Halifax.
Chief Electoral Officer Bruce Chalk acknowledges some people aren't going to be able to vote in the provincial election, but he isn't granting another extension. The deadline to apply for a ballot passed at 8 o'clock Friday evening. Chalk says there was a burst of callers as the cutoff time approached. Some weren't able to get through. But Chalk says there were lots of other ways to apply, and there was enough time for voters to register if they didn't wait until the last minute. He says every request received before the deadline will be honored, but Elections NL won't be following up with people who didn't make it under the wire. Chalk says they're processing applications as quickly as possible. Voting kits like the one you're seeing here are going to be mailed out this week and into next week. All votes postmarked on or before March 12th will be counted. Well, both the PCs and the NDP are calling on Liberal leader Andrew Furey to release the interim Green report once he has it. The report from the Premier's Economic Recovery Team is headed up by Moya Green. It's looking at areas where government can find efficiencies to help with the financial crisis. It could suggest places to cut or privatize, for example. The interim report is expected at the end of February, which would have been after the election if the vote hadn't been delayed. Because of the COVID-19 outbreak, the voting deadline has now been pushed back, but the NDP insists Furey should still release the report on March 1st.
With people in this province, we ask that he commit to releasing the interim Green report once it is received on March the 1st. Instead of making choices that only serve to a select few, we demand Newfoundlanders and Labradorians see what the Liberals have in store for them. Throughout the campaign, the Liberals have done very little to convince people in this province they won't cut the services we all rely on or reduce jobs to balance the books at our expense. Furey says he has nothing to hide. I say, prove it.
Mr. Furey rushed into the election so that we wouldn't get a chance to see what was in it. Well, now the election is being prolonged and the people would like to know what's in this. It is his blueprint for our future. We should get to know what's in it.
Well, the Liberals have said several times, including today, to us that Furey will release the report publicly as soon as the provincial government receives it.
Well, a family from Harbor Grace says treatment they're receiving in the United States to save their unborn baby is working. Kristen Penny is entering her 3rd trimester. Her baby has been diagnosed with Potter's syndrome. And that means the baby was born without kidneys and there's little amniotic fluid surrounding it. Penny says Eastern Health told her that if she didn't terminate the pregnancy, the baby would die shortly after birth. Penny joined experimental treatment in the U.S. where doctors inject fluid into the amniotic sac, which also helps the baby's lungs develop. MCP says it will cover some of Penny's routine prenatal care in the U.S., and her doctor is writing a letter to the province to try to get approval to cover some of the costs of the infusions because he doesn't consider them experimental.
It's an amazing feeling. The doctor down here has done this for a number of years. He's had a number of success stories. One little girl was actually born 2 weeks ago. He told us in one of our appointments, actually, that out of all of the bilateral renal agenesis babies that he has treated, every one of them has been born breathing. He hasn't had one that passed away because of breathing issues, which was Eastern Health's biggest concern.
Well, Penny and her husband are fundraising to pay for the treatments. She says the baby is now halfway to its goal weight to be a candidate for dialysis, and she hopes to deliver the child at the Children's Hospital in Halifax. Well, back in this province, the Salvation Army is once again serving up hot meals to the essential workers who keep our supply chain going. The church in Port aux Basques has an industrial kitchen, and that's where volunteers are cooking up a storm and keeping truckers fed, just like the last time the province was in full lockdown.
We started last year when the need was brought to our attention that truckers were not able to access food for more than 10 weeks, during which time we served 2,600 meals to truckers. And when we went into alert level 5, we anticipated possibly that the need would be there for us to step up once again and be there to support the truckers in this way. We became aware of the need, and we're restarting. Today, we are anticipating, based on the information that we have, that we will serve 70 meals. Our supply and distribution lines are critical, and we just want to make sure that they're well taken care of, and we are doing these meals for that reason. Based on our previous experience last year, there was just a tremendous expression of appreciation coming from the truckers for what we were doing. They were telling us how much it meant to them, and not only them, but members of their families as well, who were concerned about their loved ones who were on the road, and to know that they were being taken care of, to know that people were standing by the side of the road giving them hot meals, really meant a lot to the truckers and their families. And we're grateful that we were able to make a difference in that way.
The town of Happy Valley Goose Bay is calling on public health to impose point-of-entry testing for all travelers to Labrador. Mayor Wally Anderson says Happy Valley Goose Bay is the hub of Labrador, and most people who travel to the Big Land enter through the airport there. He's calling for rapid tests to be done on passengers before boarding planes at the St. John's, Gander, and Deer Lake airports, as well as testing people crossing the Quebec-Labrador border and arriving on the ferry. Mayor Anderson says Labrador needs these special measures because it doesn't have the healthcare infrastructure to handle an outbreak of the new highly contagious coronavirus variant.
The fear and the concern that we have in Labrador here that if there's a cluster and it hits here and people got to be hospitalized, we have very, very few beds at the hospital and we have very, very few ventilators. But, you know, by having point of entry testing, where Goose Bay is the hub for a lot of things in Labrador, it will cut down and it would serve a very safe purpose, not just for Happy Valley Goose Bay, but for all of Labrador.
Now, Mayor Anderson says they do understand the rapid tests aren't 100% accurate and can produce false positive or false negative results. But he says he still would prefer to see the testing happen. He says he knows other groups, such as rotational workers, have lobbied for point-of-entry rapid testing and were denied. But he says the town council is determined.
We've written our letter. Our council is adamant. If you don't make your concerns known and your requests known, you know, it'll never be dealt with. So today, when I listened to the update, I did hear the Premier say that, you know, they're aware of the letter that came from the Council of Happy Valley Goose Bay, and on a call tomorrow with leaders in Labrador that they will have officials on there to talk about this. So, you know, this is a start, and, you know, hopefully at the end of the day that they will see our point of view, and because really, when all is said and done, all we're asking here is to protect our community and to protect the other communities as well.
Time for a look at the weather forecast. And Ashley, it was nice and sunny earlier today, but boy, was it cold.
It certainly was. I was sitting in the dining room with that window and all that sunshine, but as soon as you stepped outside, it was certainly a cold one, and it was a cold start to the day today as well. Take a look at some of these temperatures into the minus teens for portions of Labrador as well as the Northern Peninsula, and then minus 13 in St. John's. Now, this is only the second time that we have seen temperatures below minus 10 for this whole winter season so far. So over the past 30 years, the average for that is normally 23. So we are well below where we should be sitting as far as temperatures go. And these records have been since 1942. Now, I don't really see anything dipping back into those minus teens, at least until we head to the weekend. In fact, we're actually going to see a warm up. So these cool temperatures that we saw today, we can say goodbye to them for a couple of days. These were our afternoon highs, minus 5 in St. John's today, and then similar, well above where we should be sitting temperatures for Labrador as well. Now, if you are planning on heading out, it is chilly. We do have a wind chill in play right now as well. It's feeling more like minus 14. So if you are planning on heading out tonight, just make sure you bundle up to enjoy these relatively clear skies, because that is generally going to continue as we head through the overnight tonight. We'll see the clouds on the increase though as we head through the overnight. The potential for some flurries along the west coast as well as along the south, including the Avalon and then western areas of Labrador as well. You're looking at the potential for some flurries tonight. So temperatures will be sitting into the minus single digits for most of the island, except in those low-lying areas, dipping into about minus 10 or minus double digits, minus teens for most of Labrador, and then the Northern Peninsula, you get into some of that colder air as well. Winds about out of the west or southwest, anywhere from 30 to 40 kilometers per hour through the overnight tonight. So that means wind chills will be a factor tonight. We're sitting into the minus teens for most of us, and as you head out the door tomorrow morning as well, you're looking at wind chill values anywhere from minus 10 to as much as minus 17 in Gander. Taking a look at tomorrow's forecast, temperatures will be hovering in and around the 0-degree mark for most of the island, except along the southern portion as well as the Avalon. Temperatures will be up into those single digits on the plus side of the mercury. So that's going to play a role in the type of precipitation we see tomorrow afternoon. And then note those temperatures up through Labrador. Again, minus single digits, quiet though, with plenty of sunshine. A few flurries will move in for Lab City. So let's play out our next weather maker for tomorrow. Again, those temperatures on the increase through the afternoon, but it will start as snow. So by morning, we're already going to start to see some snow for southwestern portions of the island. By late afternoon, we'll see a transition through to rain for the Burin Peninsula as well as southern Avalon and along the southern shore as well, southern coast rather. And as we head into eastern areas of the island, we'll see that transition into the evening hours, ending as likely as drizzle for the Bonavista Peninsula, and even through to Gander, we could see that end as some drizzle. As far as snowfall goes, 10 to, trace to 5 centimeters for along the Strait and the northern peninsula. The rest of the northern peninsula, as well as the Avalon, looking at about 5 to 10 centimeters before we see that transition. 10 to 15 for central, and the most snow will be for the southern shore. We're looking at, or southern coast rather, 15 to 20 centimeters. As far as rainfall goes, good trace to 5 millimeters of rain. The most rain will be for the southern tip of the Avalon. So that's a look at tomorrow's forecast. We'll look ahead when I come back.
Thanks, Ashley. Well, Peter, for many of us, life is much different now than it was just a few weeks ago, but folks are finding ways to not just pass the time, but also make the most of it.
Yeah, we asked people to send in their photos of lockdown life across Newfoundland and Labrador, and this week on Here Now, we wanted to share some of those photos with you, and maybe you can find a little inspiration of your own. So, first up, Sandra Cave has had a lot of time on her hands, but she's kept those hands busy making this magnificent quilt. Well done, Sandra.
That is gorgeous, and getting outside is one of the best things we can do in lockdown. We've all been hearing that. So the trails at the Menahek Nordic Ski Club in Labrador City are a very busy place these days. Skiers Dylan Jeans and Debbie Wellen were out enjoying some exercise.
And St. John's parents Naz and Bolu Oganyemi both have very busy careers in the medical field, but Naz says having daddy home is definitely one of the silver linings of lockdown. And what a cute image.
I love that one. And having more time for our hobbies is another silver lining of the lockdown. Denise Parsons painted this beautiful sunrise, just the kind of symbol to inspire people right now.
Yeah, I wish I had that sort of talent. But finally, we have a tale of 2 rinks for you. Steve and Emma Whalen are getting plenty of ice time in their backyard rink in Paradise, while Seth Cook and Cohen Cook, as well as Parker Harriet, are maybe the luckiest kids in the lockdown with an indoor rink in their basement in Port-aux-Basques.
Wow.
So, sports may be shut down, but these kids are still finding a good shutout or two.
Yeah, you know, seeing all these pictures really gave us a big lift. So a big thank you to everyone who shared their photos of lockdown life. And if you would like to share yours, please email them to us at nlphotos@cbc.ca.
Yeah, we'll be showing you more of these pictures all week on Here Now. Hopefully give you a little bit of something positive to look forward to in the show. And after the break, I'll answer some of your questions about COVID-19, so stay with us.
Well, from vaccine rollout to the testing of high school students, you've been sending in a lot of COVID-19 questions. So we'd like to try to answer as many of them as we can. And Peter, you've been asking hundreds of questions at the COVID briefings over the past year, so you're pretty good at getting some answers.
Yeah, I'll do my best to try and provide answers rather than just asking the questions. So,
well, the first question we have for you is, when will people over 80 start receiving the vaccine?
Yeah, that's been one of the big questions that I've been seeing a lot in my inbox, because right now the priority groups is seniors in long-term care homes, personal care homes. So a lot of people are saying, okay, what about, my dad is in his, is 85, he's living on his own, when's he going to be able to get access to the vaccine? And the answer really comes down to when they get access to more vaccine to give it out. So we know that seniors living together in those group settings tend to be at higher risk for getting COVID, and we've seen in places like Ontario, when the variant gets in there, it can spread to almost every member of the home. So that's one of the reasons that those groups have been the priority. We are seeing other provinces have started rolling out their vaccinations for people who are over the age of 80. And even in this province, for example, older people in southern Labrador and the Northern Peninsula are getting vaccinated as young as 75. One of the big questions today was, when are more people going to be able to get it? And the answer from the health minister really was they are not too confident on the supply of vaccine right now, so they're waiting to see some firm numbers there before they actually start rolling out some dates.
Our plan in terms of the vaccine rollout, when numbers allow, is to move away from those in congregate living, by which we mean long-term care or personal care homes, and then work our way down the age spectrum in the community. If we had the vaccine in numbers, we would actually simply start with a mass vaccination campaign through those groups, but we simply cannot give what we do not have, so we have to give it to those at greatest risk as the numbers allow with deliveries.
So the deliveries are ramping up. They're expecting to have 6 trays of vaccine, which would be close to 6,000 doses. So we'll start to see those ramp up, but right now those are being reserved for seniors who are already in those congregate living arrangements, as the minister said there.
Okay, Peter. So we found out something kind of strange and interesting today. Dr. Fitzgerald says they'll be testing for COVID in people's wastewater. What is that about?
Okay, I know people are often eating dinner while they're watching the news, so I'm not going to get into too much of the gory details here, but this is something that they're doing as kind of a surveillance technique. What they're able to do is they test the wastewater and look for how much COVID-19 is there. They have to do some sort of processing to it, but then they kind of put it in the lab and they look for the COVID-19 virus in there. And so what it allows them to do is get a sense of, are there undetected cases in the community? Are we seeing a large number of people who haven't shown up yet when we test people, that will start to show up in our wastewater testing. So it's kind of like an early warning system that they want to put in place. And so they announced today that they are starting to do this in the St. John's area, and they're going to look at other areas of the province as well to be able to start doing this sort of testing. And here's how Dr. Janice Fitzgerald explained how it's going to work.
Still very early days, and of course now where we're having an outbreak, we would expect to see higher levels. So it really will be most useful as time goes on, and once we come down from this and we see if it picks up signals in the future, really. At this point, right now, it's probably not as useful, but we do need to kind of get a baseline and see how things are going to go over the next little while.
Now, other places have actually used it fairly effectively. Yellowknife, they started seeing it in their wastewater even though they had no active cases. So that was a warning for them to try and get testing up, to get more people. And they actually said, look, if you've got symptoms, please come and get tested, because we know there are cases. We just don't know where yet.
Mm-hmm. Sounds kind of like the COVID in the coal mine sort of situation. On to another topic. So for the staff and students at Mount Pearl Senior High who have been in isolation, they've been told that they need to get tested again at the end of their isolation. Why do they need that second test?
Yeah, that's definitely different, because normally after you do your 14 days of isolation, if you don't have any symptoms, you're free to go, your isolation ends. And late on Friday, Eastern Health actually said to them, hold on a second, we want you to take a second test when your isolation ends. And the reason for this is because so many of the kids have either had no symptoms of COVID-19, so they've been asymptomatic, or they've had really mild symptoms. So what they were worried about here is that there may be some people who've developed the disease and didn't bother to get tested because they didn't think it was COVID, and they don't want them to go out into the community and risk them spreading it. So that's why they did that second round of testing.
Concern was that some of these students who initially tested negative would then go on to develop disease or develop COVID and be able to spread it without developing a whole lot of symptoms or any symptoms at all. And so we wanted to just make sure where we had so many coming out of isolation at the same time, and where they had that potential to pass on disease without really knowing that they were sick with it, we wanted to test and see if anybody was asymptomatic and positive. So, and we did find a few. I don't know the number right off the top of my head, but we did find some.
So yeah, so they've said all along that this new variant is a game changer, so they've been changing their plans, Carolyn, for how they deal with this situation as well.
Okay, and we did hear some good news today that there are more recoveries than new positive cases, but we also now know that 5 people are in hospital. That's a number that we haven't seen since last April. Do you know if any of them are in the ICU?
So the answer is yes. Some of them are in the ICU, but we don't know how many of them. And that's something that's a little bit different from the first wave as well. They used to report exactly how many cases of COVID were in hospital and how many of those were in the ICU. And then they've stopped breaking down those numbers. And today we asked Dr. Fitzgerald, she confirmed that yes, some of those 5 cases are in there, but she wouldn't tell us any more than that. And here's how that exchange went with one of the reporters.
So I don't think I can go any further than that, just because of the small numbers, except to say that there are some ICU admissions.
Okay, not as a follow-up question, but I remember back in like March, the very onset of the pandemic, we were getting those numbers.
Mm-hmm. You were. And
all right, thank you.
Yeah, so I have followed up to find out why the change, because these numbers are significant because it tells us a couple of things. One, how much capacity do we have in the healthcare system? If we know a lot of ICU beds are being used, then that's one of the concerns. Are there enough ventilators, things like that? And it also just tells us how sick are people getting for this disease. We're hearing on the one hand, lots of people have very mild disease. Well, how many people are getting that severe disease where they actually require ICU intervention? If we don't have the numbers, we don't know. So I'm hoping that the department will give us an explanation of why the change in tactic, and because other provinces like New Brunswick and Nova Scotia, they have been reporting the exact numbers of ICU beds. So a little bit of a different tactic, Carolyn, and we'll need to see why the difference here.
Interesting. And do you expect another briefing tomorrow?
Probably not. They've been kind of doing them Monday, Wednesday, Fridays, but I've learned not to predict anything with COVID, so.
Fair enough. Thanks so much, Peter.
My pleasure. there are significant changes for international travelers arriving by air in Canada today. They include a mandatory COVID-19 test and a hotel quarantine at the traveler's expense. As Ellen Morrow reports, many travelers are already frustrated as they struggle to comply with the new rules.
It was extremely frustrating, kind of like a roller coaster of emotions.
Chris Hederachi has been trying for days to book a quarantine hotel for his wife, traveling home from Sri Lanka, who he hasn't seen in more than a year. After countless hours on hold, Hederachi finally got through this morning.
It's just that they make these rules and then it becomes almost impossible to get through and actually follow these rules in reality.
Hederachi is not alone, with phone lines jammed for reservations that can't be made online.
The number which they have given is really very difficult to get in. I was trying, my husband was trying for long, 2-3 days, and I didn't book the ticket.
Starting today, international arrivals must stay in quarantine hotels like this one in Montreal for up to 3 days as they await results from the now required on-arrival COVID test. Each individual hotel can determine the price, up to $2,000 for 3 nights. Refund policies vary too. If test results come early, a traveler at one hotel might get some of their money back. One at another might not.
We can have our quarantine in our home. No one else lives with us. We're all together, so I don't understand the purpose for the hotel since we have full accommodation and we are Canadian citizens.
At land borders, too, travelers must show a negative COVID test taken within 72 hours before crossing, and starting today, take a test on arrival and towards the end of the 14-day quarantine period. The tough and pricey new measures all meant to deter travel, with more contagious variants of the virus on the rise and fears they will spark a third wave in Canada.
If they are followed, if people follow the rules, and if they are applied universally and consistently, they will help.
Hederachi is grateful he finally got through on the phone, and even more grateful that he'll finally be reunited with his wife.
If anybody else is going through this, don't give up, keep on trying. That's really all you can do.
Ellen Morrow, CBC News, Toronto.
Well, even as the daily coronavirus cases in the U.S. continues to trend downwards, the nation with the highest number of infections marked another grim milestone today. A total of 500,000 lives lost and counting since the pandemic started a year ago. It underscores the devastating impact and the ongoing threat from COVID-19. Nick Harper reports from Washington.
A year ago, former President Donald Trump predicted COVID-19 was just weeks away from disappearing. But 500,000 deaths and 12 months on, a stark contrast to that view. It shows a country unprepared and unable to stop the early and deadly spread of the pandemic. To mark today's tragic milestone on Capitol Hill, House Speaker Nancy Pelosi led lawmakers in a moment of silence.
500,000 Americans who've passed away from the COVID-19 virus.
There are, however, positive signs, with fatalities falling over the last 2 weeks by more than 30%. New infections are also down by 44%. But health officials are cautioning now is no time for complacency.
To have these many people to have died from a respiratory-borne infection, it really is a terrible situation that we've been through and that we're still going through. And that's the reason why we keep insisting to continue with the public health measures, because we don't want this to get much worse than it already is.
Dr. Fauci is urging people to wear masks as the vaccination rollout continues. President Joe Biden hopes to have enough vaccines to inoculate the entire US population by the end of July. So far, though, less than 19 million Americans have received both doses. That's less than 6% of the country. And even that progress has been hard-won. ICU physician Ian Dolores, on the front lines of the fight against the pandemic, lost his grandfather to COVID-19.
Each of those 500,000 people is someone's grandpa, it's somebody's dad, it's somebody's sister, mom. I mean, it's not a nameless, faceless number.
Like Ian, the president wants the milestone to be a moment to remember the people behind the statistics, to remember the lives lost, the families forever changed. Nick Harper for CBC News, Washington.
Back in Canada, today is the start of tax season, the first day you can file your taxes online. But if you're dreading the task, you're not alone. There's plenty of anxiety out there about what's being seen as one of the most complicated tax seasons ever, with everything from job losses to working from home to government relief supports in the mix. Hannah Thibodeau has more on what taxpayers can expect and what the Canada Revenue Agency is doing.
Alice Antronikian knows demand for help filling out this year's taxes will be high. She volunteers at a BC Seniors Centre.
They're edgy. They're edgy.
The seniors are edgy because there are new government benefits that have to be taken into account, many considered taxable income, and it could get complicated.
Usually we have 4 to 6 people who do that, but we definitely have to increase that number.
Many seniors in BC collected the Provincial Recovery Benefit, a one-time tax-free payment of up to $1,000. Anyone who got a provincial or federal COVID-19 benefit and made less than $75,000 won't have to pay interest on any taxes they owe until next year. This benefit was announced by the Prime Minister in February and could help as many as 4.5 million Canadians.
Right now, I don't want you to have to worry about what you may owe in taxes. That's why we're providing 1 year without interest on certain 2020 tax debt, giving people more flexibility to repay amounts owing from last year.
To beef up for general questions about tax season, the Canada Revenue Agency's call centre will add staff and extend hours.
We had over 1 million calls to our call centers and versus 80,000 in the prior year.
In March, the CRA is also planning to hire 2,000 additional workers who will be able to help people with their specific account questions, including help with deductions if you worked from home and spent money to do so. The CRA says there's a new home office deduction of up to $400.
It's a very simple document. You just put your estimated amount is it's $2 per day of deduction, and you can calculate your days. But it doesn't require any filing of documents.
One thing you shouldn't expect is an extension to file your tax returns. Unlike last year, the deadline to file taxes for individuals is April 30th. Hannah Thibodeau, CBC News, Ottawa.
This weather update is brought to you by the Healthcare Foundation Home Lottery. Order tickets now at hcfhomelottery.ca.
Ashley is back with a look at the long-range forecast. So Ashley, we'll see a little bit of a warm-up tomorrow, but how long will that last?
Yeah, so once this area of low pressure moves off, we're going to see this generally continue, these mild temperatures, with our next weather maker on the way as we head into Thursday and Friday. So let's take a look at that. There's that area of low pressure that will affect us on Wednesday, or rather Tuesday night into Wednesday. We're going to see a little bit of some cool down into the evening hours on Wednesday, and then the next one will move in on Thursday. So this again will take the same track essentially with the same transition. So starting at snow, changing over to rain as we head through the day on Tuesday, which means another warm up for eastern areas and along the southern portion of the island. That'll move off into early Friday morning, and then we'll see that transition back to snow. So overall temperatures will be above zero as we head through the day on Wednesday, 2 degrees it looks like. And then again around the Burin Peninsula, you're looking at temperatures hovering near or just above zero. Otherwise, the mild temperatures stick around for Labrador. -6 in Happy Valley, Goose Bay again, Lab City at -5 with that potential for some flurries, and then Nain looking at -8 and plenty of sunshine. As we head through the day on Thursday, again that mild up, looks like we'll see even warmer temperatures, so 2 to 4 degrees at this point. Again, that transition from snow through to rain. Most of central and west will stay as snow at this point, it looks like, with temperatures hovering around the 1 degree mark. Minus single digits for the northern peninsula, and then we start to get back into some of that colder air for Lab City as we head through the day on Thursday at -14. Note these mild temperatures stick around through Friday, although it is looking like what does fall will fall is some snow for Friday. Saturday, some clearing skies through the afternoon, but that big dip in those temperatures. So back down to the minus double digits. That's when we should see tack on another -10 degree day. For central Newfoundland, you're looking at a similar drop, except it'll happen Friday night into Saturday. Plenty of sunshine, the story for you. As you head into the weekend, temperature hovering around the -2 degree range. And then for western Newfoundland, a little bit colder. So mid-minus single digits and minus double digits as you head through the overnight. But again, unsettled. And then for eastern Labrador, you're looking at single digits right across the board, so well above where we should be sitting this time of year, although it does look unsettled through Friday. And then for Lab West, you're looking at sunshine into Friday, -16, and then a big or a jump again into those temperatures, -10 by the time Saturday rolls around. Speaking of winter, take a look at this photo. This is riding in a winter wonderland through Gander Central, seeing some beautiful scenery this time of year. Chris Tuck shared that photo with us, and if you have any weather photos to share with us, send them to nlphotos@cbc.ca.
Thanks, Ashley. All right, Peter, one more question before we go. I noticed that the Premier and Dr. Fitzgerald were wearing masks at the briefing today, something that we haven't seen them do before when they were answering questions. Why was that?
Dr. Fitzgerald said basically this is just an example where they want to lead by example. So that's why today they were wearing their masks. Here's what she said.
Just recommended that everybody should be wearing masks outside of their household bubble. So I think we just need to set the example, and just to say that it wasn't everybody in the media room who wasn't wearing masks. It was just us. So we just felt that we needed to wear them as well.
Okay. There you go. Another reminder of the importance of wearing a mask, especially with the more contagious variant being the one that's circulating in the St. John's area.
Absolutely. Thanks, Peter. And thanks to you, everyone at home, for watching. We'll see you tomorrow.
Have a good night.